Daniel Frost, CEO of Citron, and I'm excited today to be with Alyssa from Health South. And why don't you start and introduce yourself and give us a little bit of an idea what brought you to us today.
My name is Alyssa Hagen. I am an internal communications manager at Health South, and I've been with the company a little over 6 years, and I've had the privilege of focusing on employee communications, which has been very exciting, a very good challenge for me. I started in PR, so this has been a completely different spin on the communication world, and it's been great.
Well, thanks so much for being here today and for spending all the time with us. I have been talking to other customers who have seen what you presented and what you achieved, and they were super excited about your success. And I hope that you're going to have many more of those awards that you're currently being nominated for. So thanks so much, and keep up with this wonderful work. You're doing really great stuff out there.
Thank you, Daniel. I'm really excited to have been a part of this today.
Tell me a little bit about Health South as an organization. When I got to know you, I was reading everything that's publicly available, and I was so excited about what you do and the new way of you want to better integrate that. So this is really exciting. Tell me a little bit how you experience that inside.
Sure. So as I mentioned, Health South is very transparent from leadership down. So we get to know a lot about what the company is, what the plans are, what's moving forward, how we're helping to drive the company. One thing that our CEO has said before and really resonated with me was working in healthcare from a corporate office perspective, you really can make an impact on people, even though you're not physically at the patient bedside. And so I like that even though I'm not a clinician, I can help people in our organization make a difference in other people's lives. And that's what Health South is all about. Inpatient rehabilitation is all about taking somebody after an illness or injury or accident and bringing them back to the functionality that they once had, getting them back into their community, going bowling again, or cooking dinner for their family. So it's been really neat to, from that higher level perspective at the corporate office, be able to impact our employees who are in turn impacting their patients.
I saw that in the financial presentations your CEO gave, he also stated that technology plays a key role to improve the organization. Now you're deploying a new technology. You're breaking, barriers. You're introducing new things. How is that going?
It's going well. I will say our CEO thought it was his idea or says that it's his idea to use a mobile app to reach our employees. So we were very excited to jump on board with that and explore the option. And so I think that we have a lot of opportunity with the app to better reach our employees. In the healthcare industry, most people are not in front of a computer. So mobile is the way that things are going. So to reach those folks that are in front of patients all day, that maybe don't have time to do some key functions that they need to do their job or just access their PTO or their benefits information, they can do that on Saturday morning if they really want to, or they can do it on their break while they're having a snack or whatever it is. It's nice to be able to have that opportunity through this new technology for our employees.
So I was reading that your CEO actually made a public statement in one of the investor calls that he believes technology is a key to be more successful in helping patients. How did that translate into your actions in the organization?
Sure. So we took that and ran with it and decided if he's on board for new ideas and new technologies to help our employees, who then in turn help our patients, then let's try this idea for the mobile app. And so we took the Citron technology and really fine-tuned it to fit what our employee audience was going to need. And so the ability for them to do a few key tasks that maybe they don't have time for in their average day of patient care, do those tasks on their phone when they do have that time. Saturday morning, looking at their PTO, planning a vacation, or during a break when they just really quickly need to access certain content.
So I was looking at Health South and I saw that you're quite a growth company.
Yes, Health South is in a huge state of growth right now. We are currently, throughout 2016, by the end of 2016, set to have added 200 additional patient beds across our footprint nationwide. That footprint consists of 123 inpatient rehabilitation hospitals. We also have over 200 home health and hospice agencies that act as that continuum of care. So going from inpatient rehab, once you finish your stay with us, then if you need additional care, you will transition to hopefully one of our home health or hospice agencies to continue that care in your home and have that next step that's needed. So that's kind of our platform. We have 30,000 employees across the country in 6 operating regions, and reaching them with information that they need, it can be difficult. And so, but growth brings opportunities to try and reach them in a different way.
So help me to understand who works at Health South. Who are the people who make this wonderful work of helping patients happen? And now you, as a communication professional, how you reach them, that would be something I would really keen to learn about.
Sure. So being a healthcare company, the majority of our employees are clinicians. They're nurses, they're nursing technicians, they're therapists, which includes speech therapists, occupational therapists, physical therapists. That's the majority of our employee base. And they're not sitting in front of a computer all day. They're not. They're in front of the patients doing their job, getting these people back to the things that they love. And so we are trying to reach them outside of a typical desk space because they don't have one. They're just not at a desk. So mobile with Citroen One really gives us that opportunity to reach them through a quick newsfeed where they can grab information as they have time. And we can also provide them a few little hooks here and there of why they would want to download the app. You know, maybe they can see their PTO or their benefits elections or follow additional content. They're always looking for educational resources. So I'm putting that content in there because I know that's going to bring them to that space. And then in the meantime, they'll get to see the other corporate content that we need to send to them. We're also given the opportunity with the app to have our local delegates in the hospitals reach those folks with their local information. We've heard over the past few years that some employees felt disconnected, even though they're all in the same building. Maybe there was a retirement party for a friend at the hospital, and the invitation went out on Facebook, and they're not on Facebook. Okay, so how can we reach them instead and have everybody in the same community as a Health South community instead of something external like Facebook? So that was just a use case of if we get them all there, then we can share local information and not just fun things like retirement parties, but also, you know, maybe you need to complete a training or we're having a town hall meeting next week, things like that that are more business related.
Tell me a little bit more about this regional approach. You mentioned that you have an HR person in each of the hospitals, but that is not necessarily always a full-time job or the only job that this person is doing. Tell me a little bit more about it, and also about how you empower them.
Sure. So yes, each of our hospitals has a human resources director, and they wear many hats. Communicator is probably on the bottom of their list, but it's still thrown into their job description. And so we have given them the power to send messages through the app to their specific employees. And with that, I've given a lot of training on good messages to reach your employees with content that would be helpful to them. In case you can't think of any on your own, here's a big list of what we've heard employees are interested in. So yeah, just giving those resources to them to know how to better communicate with their employees. As I've rolled out the app to each operating region throughout the country, I've provided a webinar. I've gone through literally showing my phone and giving them a feature rundown. Here's what all the app can do so that they can then communicate that to their employees and drive adoption at their location. I also gave them a tutorial of how to use the content management system. We made a huge effort with Citroen to make that content management system as simple as possible to use. It's just a simple fill in the field form, upload a photo, and hit go. And that to me is very important for these people because, like I said, they're not communicating on a day-to-day basis in a function that I am. They are, but not in the same way that we look at what corporate communications is.
You also mentioned that your organization is embracing the idea of BYOD. Tell me the story about your view on BYOD and the realities.
Mm-hmm. The reality for it at Health South is really that we have 30,000 employees. Only our corporate office and mainly the leadership teams in our hospitals, which amounts to, in total, about 2,000 employees, have a Health South provided smartphone. And so that's a very small number. So in order to get the employees into the space, into the app community, we had to say, bring your own device, any device you want, tablet, smartphone, whatever is most convenient to you, bring it on, and we will send you the information that you need through it. The other piece around that, though, it's not just a financial thing. It's not just Health South doesn't want to provide devices. It's people like personal aspect. Their phone is their life for most people. So the ability then to just quickly download a free app that has Health South information in it, they can do that at any time, whenever they need to.
What was really impressive when listening to your story was that you didn't just make this all up and say we need this app. You actually had a real project in place where you went deep into the different personas and the individual at Health South to find out what works for them. Share a little bit about that.
Sure. So when we decided we wanted to roll out an app, we really placed a heavy emphasis on employee listening, wanting to get in their heads and know what would make a good product for them. Because at the end of the day, if they don't download it, it's unsuccessful. You're not reaching them where they are. So we did a design strategy workshop where my communications team, as well as some HR stakeholders from various areas, whether that's our talent acquisition team or employee relations, we all got together and talked about what features we would like to see as the stakeholders. Mm-hmm. Then we spun that on its head and said, let's create some employee personas of a nurse. What would Susie Nurse want to see on her app? What would Tommy Therapist want to see on his app? We looked at those different employee personas and decided which features would be beneficial for them. And then we compared those two lists and found our feature list to start. And we also made sure that we didn't start too big. There weren't too many features in our first version of the app. We started with that minimally viable product and decided we would have 3 main key features and reach employees in that way.
I love the how you named the app and the entire in-app branding that you provide there, that you basically bring this as a home to the people. Tell me a little bit more about it, and what are the services that you have in your employee app?
Sure. So we named our app Hive. So it's a beehive buzzing with activity. It's just a community. As I mentioned, we haven't had a social space for employees before. So bringing that community aspect to the app was a big piece of it. Plus, our hospitals like to get excited about things. And so using that Hive and bee branding, they are able to do a lot of fun launch parties and other adoption tactics. I've seen people dressed up in bee suits. I have seen cupcakes with little bees on them. They're having a lot of fun with this to get their employees engaged. So the main features that we have include a news feed where I can post global content to all employees company-wide. I can also segment my content to maybe just reach a certain region of hospitals. That could be around emergency situations. If a hurricane is coming to hit one of our states, I can focus on just that state of employees. Or if there's just something new coming to a certain region, if we have an acquisition and we want to tell those employees first, I can target them directly and reach them that way. We're also in that newsfeed giving the human resources directors at our hospitals the opportunity to post local specific content that just goes to their employees at their hospital. There's no way for them to accidentally send a message, to someone in a different state. So that's key. We also have the My Benefits micro app under the services area of the One app. That we think is going to be the hook to get employees to download the app. So far, it's the favorite feature of those that are on it. But that's where you can see your PTO balance right in the palm of your hand. That is huge because it's eliminating a barrier. Before, you had to log into a computer, which most of our employees don't have their own computer at work. So they had to log into a computer, then log into PeopleSoft, and then find their balance. Now it's just a click of a button and it's right in their hand. They can also see their benefits elections in there. So only the items that they have elected to through the HealthSouth plan they can see. And then there's also a resource library. And that's where I can put global documents and links just for helpful information. So there's a benefits contact card in there. So all of our benefits vendors, there's quick links to go to their websites or to call. You can call directly from inside the app. And then we also have in there, a quick link to healthsouth.com, our external website, as well as our investor website. A lot of our employees have asked, how is the stock doing? How do I keep up with that? Well, now they can easily get to it in the app.
So since you're providing an employee app, which is for every employee, who are the internal stakeholders who are most excited about that?
I would say almost all of our corporate departments are very, very excited about the app. Their brains are ticking. How can we get my use cases into this tiny little thing? But the main use cases that we have started with our current features and next steps for enhancing the app are HR related. So our employee relations team, our compensation team, those folks, our benefits team, those folks have been integral in making sure that the employees have access to their PTO balance, their benefits information, and it's been good working with those teams to better collaborate on how we can reach employees with the information that they need them to see.
What were the key reasons to go with Citreon?
So the main reason, after we did all of that employee listening and figuring out what features we really wanted in our app, we even had some vendors come on site and give us presentations. We had, off-the-shelf vendors as well as, we can create whatever you want vendors and a hybrid of the two. And based on what we heard from our employees and the features that we needed and the infrastructure that our IT team has, we did not have the capability to just create whatever we wanted. So we decided to go with an off-the-shelf vendor. And talking with Citreon and your representatives, it was great to learn that somebody is going the same direction we are. Your product was very, very helpful to us in seeing, wow, they have this all together and they can integrate with our systems and work with us. And since we've signed that contract and since we've moved forward, you have proven over and over that Citreon is a partner. That is how I see you. I don't see Citreon as just a vendor. It's definitely a partnership. Anytime that we have an enhancement that we'd like to add to the app or improvement suggestions or just questions, I feel very comfortable going to the team and saying, hey, how can we make this work? Or do you already have a solution to this problem? And how can we implement that into the app? It's been a great relationship.
That's wonderful. At Citreon, we're really trying to make work better. That's our mission. So when you're looking at your organization, where you are today, take a look into the far future, a few years down the road. What would you like to see at HealthSouth to improve? What are the things that excite you that you can now address with the technology platform in place?
So for next steps for HealthSouth, I really see the fact that we've jumped on board with this employee app and that our executive leadership team has embraced it and is excited to see what we can do with it. It's really opened some doors for our internal communications team and just internal comm as a function at HealthSouth. It's making our team more visible with our executives, with our peers, with companies that are potentially going to give us an award for this. So it's really been a great opportunity to move forward in that space. And I think it will continue to give us opportunities to say, hey, this worked. Let's try this next thing that's on the horizon. Whatever that next thing is, I think we've got the buy-in now at HealthSouth, and I think we've proven to our leadership team that we can do this and we can take this project and run with it.
Well, thanks so much.
Sure.
And thanks so much for, the presentation you gave and most for that excitement and this upbeat spirit you're bringing in. It's like we have many customers that are positive, and many we have a great relationship with over years. I was talking to Stephanie this morning, and I saw the folks sitting there, and then I saw you, and then it's like, there's a little bit of shining there. It's really nice there. You're bringing something to this team, and they're going to appreciate that. I have many people approaching me saying, we want to be a little bit like HealthOps.
Oh, well, that's good. Good. I'm glad that we can be kind of on that cutting edge. I feel like healthcare, a lot of times you're either way ahead of things or you're kind of behind, because we're focused, the core business focuses on patients. So the corporate office kind of gets put behind. So it's been nice to kind of step out in the limelight and be that pioneer in this space.
Well, to some extent, you like a sports team, right? The players, like the nurses, they play every day out there. Everybody knows exactly what a baseball player is doing, and everybody knows exactly what a nurse and a doctor and all of them are doing. But the coaching team, the caretaking team, those are the ones who are making sure they are actually coming back to work the next day. So you're doing an amazing job.
Well, good. Thank you. We're there to support our hospitals. That is what the corporate office is all about, and I love it. Like I said before, it is a great way for me to contribute back to local communities through healthcare without actually being a clinician. And that's been really near to my heart.
And the way you're treating this regionalized approach, this is really good, because giving the power to a person that has no chance to ever reach a state of reach that you have right now. Like, hey, your local HR director, and you want to talk to your people? Here it is. Yep. What do I need to do? Just communicate. Really? That easy? That's really cool.
Yeah, they're all very excited. I have not had anybody come and say, this is terrible. Why would I use this? No, it's all very, very positive, and they're so excited to finally have a tool, and a tool that they can then measure how they're reaching their employees.